everyone. Today we're going to be talking about some of the more common sleep problems in children. Just a brief outline of the things we're going to touch upon. The importance of having a bedtime routine, sleep association, delayed sleeping, night terrors, nightmares, the avoidance of blue screens. And we're also going to talk about a couple of the medical issues such as sleep apnea and medication. And I apologize for not being as comprehensive as I would like to be, but sleep is not only a common problem, it's very complex. So I'm trying to choose the subjects that are the more common and also have some quick fixes. First of all, let's talk a little bit about the importance of sleep. We have to make sufficient sleep a real priority. It's just important as nutrition and physical activity. We know that sleep deprivation leads to some pretty difficult behaviors and some other health problems. It can cause irritability, difficulty concentrating. It can lead to hypertension and obesity. Some people suffer headaches if they don't have enough sleep, and depression. Children who get enough sleep have a healthier immune system. They have better school performance, better behavior, better memory, and overall better mental health. So it's a very critical thing. We'll start off with some basic tips about sleeping. The first thing is to always have a routine. We all do much better with routine in general. Waking up at the same time of the day, having our meals the same time of the day, having exercise, and then having the sleep routine and going to sleep around the same time of the day. It just works well with our rhythm. Be active during the day. Try to get kids to exercise in the afternoon or the morning, just not right at night, right before they go to bed, because then they'll have a harder time sleeping. Know that teens need more sleep. They don't need less sleep. They are sleepy often because they need more sleep. And try to avoid caffeinated beverages. In order to have a good sleep cycle, we need to maintain regular sleep and wake times. So you don't want to be changing your schedule for the weekdays and then the weekends, because that interferes with rhythm. And that's a problem because a lot of times parents like to sleep in on a weekend, on a Saturday or Sunday morning, so they hope that their child sleeps in, but then the child then is thrown off with their rhythm. They have a hard time then going to sleep that night, and that will really create a problem when it comes to getting back to on a schedule for school days. So we always want to try to have the same sleep and wake times, even on weekends, even during school holidays. Remember to avoid stimulating activities at bedtime, and that can be a problem for a lot of us who work. You know, we go home, we see our children at 7 o'clock at night. We want to spend some time with them. Dads especially like to come home and start wrestling with the kids and throwing them around, and all of that can rev the child up. So we have to be careful to remember, if we're about to get them to go to sleep, we have to stick with our routines. We want to create a sleep-supportive and safe bedroom and home environment. So we want to, really kind of after dinner in the evening, start to turn the lights down and maybe turn the temperature down a degree or two, because we all sleep a little bit better when it's cool, wrapped up in a blanket. We don't want to fill the child's bed with too many toys. A lot of times kids have all these stuffed animals lined up over their beds, and then they have to count them and play with them. Choose one or two things: a favorite doll, a favorite bear, a favorite security blanket, to help with the separation anxiety, but don't have too many things in your bed. And remember not to put a baby to bed with a bottle. So how much sleep do kids need? This graph kind of tells over the course of time, including naps, what the average sleep the kids need. And you can see there's a lot of variability. So an infant may need 12 to 16 hours a day, including naps, but that's a difference of 4 hours. So one baby may need 12 hours, another baby needs 16 hours. 4 hours a day times 7 days a week, that's 28 hours. That's a big difference for parents and the amount of time a child needs to sleep. So it's variable, 11 to 14 hours with naps as a toddler, preschoolers 10 to 13 hours, grade schoolers 9 to 12 hours, and teens 8 to 10 hours. So this is kind of the recommended, but remember, again, there's that variability. Now, screens, again, we've said this time and time again that it's so important not to have screens in children's room before they go to bed. This child is trying to stay awake to look at the screen to see what's on there. Blue lights in particular are not good for sleep. So blue lights, as from the tablets and e-readers or smartphones, they have a wavelength that affects the levels of melatonin more than any other wavelength does. So the blue light actually fools the brain into thinking that it's daytime. So we feel more alert when we should be getting sleepy in bed. And over time, this wreaks havoc on our body's natural production of melatonin. So the American Academy of Pediatrics recommends avoiding exposure to screens for at least 1 hour before going to bed. Using devices past this time is not good. And also remember, even just a lot of what they're playing, those video games can be violent, or shows can be violent, and they can also interfere with sleep. So again, cell lights, TV blue lights, they're not good, and should try to keep them off at least 1 hour before bed. And I can't tell you how many people I see that have TVs in their children's room. We really highly recommend against that, no TV in the room, not only for the blue light, but it also just overall interferes with sleep. There are the 3 B's of a bedtime routine, and we want this to be a fairly consistent thing. Again, children get into a rhythm, and that's when they do their best. You want to have them brush their teeth, read a book, and then go to bed. This whole process should not be hours and hours. It shouldn't be any more than about 30 minutes. Again, brush those teeth, take out a book, and then put the child to bed. It's okay to have a transitional item for an older child, not for a baby because we don't want anything in their cribs, but for an older child, a special stuffed animal, a blanket, a lovey, helps a little bit with that separation. It's just something to cuddle with. So a few tips for babies. When you have a newborn or a baby that's still waking up during the middle of the night, you want to be calm and quiet when you go in to feed the baby or change the baby. Try not to stimulate him or her too much because we want him to kind of, again, eventually get used to sleeping. If you start to hear the baby fussing, wait a few minutes before responding to the fussiness to see if he or she can go back on her own. And then if you need to go in again, because she needs to be changed or whatever, you want to keep it nice and calm and quiet in there. By 6 months of age, typical kids do not need to eat during the night. Now there's something called sleep association that's very important. So when you have a newborn or a young baby, we tend to hold that baby. And of course, you know, we love to cuddle with babies. We love that child. There's nothing like the miracle of birth in a newborn baby. And we tend to hold them and rock them. And that's how we end up putting them to sleep. So the baby's kind of used to us kind of holding and rocking them. They may fall asleep in our arms. However, around the age of 6 months, it's really important that we start to put the baby to bed when drowsy but still awake. And this is something when I was a practicing pediatrician, I would turn to parents and I would say to them, listen to me carefully. This is one of the more important things that I can teach you. If you wake up the baby, even if the baby has just fed and fell asleep nursing, you need to wake the baby up and put the baby in the crib, drowsy but still awake. This will help your baby to learn to fall asleep on his or her own in his or her own bed. Holding or rocking her until she's completely asleep will make it hard for her to go back to sleep when she wakes up during the night. So this is a critical stage and a critical thing for parents to do if they want their child to learn to sleep on their own. So put them in that crib. Because in a couple of months, they're going to be getting older. They're going to be standing up in that crib. And they're going to be, if they're used to their parent being with them, they're going to scream for their parent to put them back to sleep. So probably the more common thing that I see is what they call sleep onset association sleep problems. And that's, again, kids who have just gotten into very bad habits. It started as an infant. We held that little baby, we rocked them, we put them to bed when they were asleep. Then the child wakes up, the parent goes back in, rocks them again, sometimes lays down with them, sometimes they start to rub their mom or dad's hair or face. So they're used to having their mom or dad to fall asleep. That's their sleep association. Now then what happens around 9 months, 12 months is babies start waking up. It happens to all of us. We all wake up in the middle of the night. And when we wake up, we normally just kind of maybe look at the clock and roll over, put our head back on the pillow and go back to sleep. It's a normal thing. We're supposed to all wake up in the middle of the night a little bit, but then be able to get back to sleep. But if a child has never learned to fall asleep on their own, they've only been falling asleep with their parents, they're going to continue to call for their parents. So it's going to require the caregiver intervention to get them back to sleep. So they won't be able to sleep by themselves unless they reach out to their parent. Again, so we may want to, a lot of parents let their child fall asleep on the couch or with them and then put them to bed, carry them into their room, and we think that they're asleep and that we're going to be good for the night, but that child is going to wake up or lighten in their sleep in a few hours, and they're going to be looking for the parent because that's how they fell asleep. And then the child gets older and older, and then we have the whole family in bed after a while because we have more children and they're having difficulties separating. And if you kind of look at this little boy curled up next to his mom, when that little boy wakes up in the middle of the night, how he gets back to sleep is to be curled right next to that mom. That's what he needs in order to go to sleep. And as much as this looks like a nice family, I guarantee they're not getting much sleep during the night. So now this is the common thing that they come to us. The child's now 4, 5, 6 years old and still sleeping in the parent's bed. So what are we going to do about it now? It's hard. It's hard to break these habits. So there's what they call the standard extinction. And that's basically just telling the parent, just let him cry it out, and you close the door and you don't go in there. And you know, it works. If you can stick with it, it will get worse before it gets better. The child cries, the child may end up throwing up, and it's very hard for a parent to do that. There's a modification of that called what we call graduated extinction. And that's where you put the child to bed drowsy, but still awake. Again, you want them to be very tired and you put them down. And then you used fixed or progressively longer intervals to go in and check on them. So the child's going to be calling for you, and you go in after a couple of minutes and you say, it's okay, go back to sleep, and then you leave. And then the next time you wait maybe 4 minutes, and the next time you wait 5 minutes, and you have progressively longer intervals. During this time, you want to minimize interactions. It's not like you want to be talking to the child. You don't go in and start kissing them and hugging them. It's just a go back to sleep, but it's a reassurance. You don't want to be doing this when you're on vacation. You don't want to be doing this when you have company, your in-laws visiting. You want to choose a time where you can stick with it. And it's hard. These are difficult things to do. And a lot of times parents are successful. They stick with it for a while. And then after 3 or 4 days, they're tired and they give in. And that's what we call intermittent reinforcement. And intermittent reinforcement teaches the child that if they cry long enough and loud enough, they will eventually get what they want, and therefore they will continue to do that. That type of intermittent reinforcement actually makes the behavior worse. Another key that we have to do in order for this to work is you have to make sure the child is awake during the day. We want them to be tired enough they're going to fall asleep at night. And generally, if you can stick with it, generally you do see improvements within a week. Again, because what happens after a while, it is exhausting and parents are just tired, and that's why they often give in. Just a couple of caveats about this. You really don't want to be doing this unless the child's at least 6 months or above. You want to be very careful with the anxious child because there's more issues at play there. And if a child has underlying medical issues like reflux or other medical conditions, you also have to be careful. I want to talk to you a little bit about night terrors. Night terrors are a little bit like nightmares, but a little bit more dramatic. And during a night terror, a child might all of a sudden suddenly sit up in bed, they shout out, they scream in distress. I mean, they look like they are very upset. You can see the adrenaline. They're breathing faster. You can tell their heart is beating faster. They may be sweating and thrashing. They're acting upset and scared. And they don't even recognize you or talking to you because they're still in their sleep. They act upset and scared, and then after a few minutes or sometimes longer, the child just kind of simply calms down and returns to sleep. It can be very frightening. I remember one time when I was working late at night, a parent literally brought their child from their home right into my office because they were afraid that the child was having a seizure. It can be that frightening. Unlike nightmares, which kids remember, kids don't have any memory of these night terrors and what happened. There's no mental images to recall. Now, night terrors happen during deep non-REM sleep. It's more like, it's not really a dream, it's more like a sudden reaction of fear that's happening during a transition stage. Night terrors, interesting enough, usually happen just about 2 or 3 hours after a child falls asleep. And that's when the sleep moves from the deepest stage of non-REM sleep to a lighter REM sleep. Usually this transition is a smooth one, but sometimes the child becomes upset and frightened, and that fear reaction is a night terror. Now, who gets night terrors, and when do we notice them more? So night terrors have been noted in kids who seem more overtired, kids who are ill, kids who are stressed, perhaps a new medication, perhaps sleeping in a different environment. They're not getting enough sleep on a regular basis. They may have had too much caffeine. They're relatively rare. They happen in about 3 to 6% of kids compared to other nightmares, which happen just about all the time in kids. They usually occur between the ages of 4 and 12. Most of the time I see them happening more in that preschool 3, 4, 5, 6 age, but they have been reported in babies as young as 18 months. Now, how do you treat night terrors? I mean, there's really no treatment for night terrors per se, but you can help prevent them. Again, reduce your child's stress. Parents will bring their child in with increased night terrors and not understand what's happening, but it's usually during some major transition in their life. It could have been a move, it could have been a change in the household. So you're trying to figure out if there's stress and how we can reduce that. Again, keep that bedtime routine simple and relaxing. Make sure the child's getting enough rest and is not overtired. Don't let them stay up too late. Make sure they have an empty bladder before they go to bed. And then an interesting thing about night terrors is a lot of times parents can predict when they're going to happen. They will say that they happen every night between 11 and 12. And if you have that prediction, you can go in there about 15 to 30 minutes before you think they're going to happen and arouse that child. Wake them up, turn them over, talk to them for a minute, and then let them go back to sleep. And a lot of times that can prevent the night terror from occurring. Okay, nightmares are real common. They're characterized by disturbing dreams that usually occur during rapid eye movement or REM sleep, and then they wake up. The child has significant anxiety after waking up and sometimes can't fall back to sleep. These are very common. They peak probably from the ages of 6 to 10. They often can be associated with stress also. They can be brought on by medications. So if your child is starting to have nightmares and they have just started a new medication, double check with your pediatrician. Again, try to maintain good sleep hygiene. Be careful what kids are watching on TV. And a lot of times parents are not aware that kids are sneaking in and watching TV with an older sibling, or a commercial may come on. Some of these commercials are very, even during a family show, can be very scary. So be careful of those kind of things. You can keep a night light on them because everything looks worse in the dark. Again, providing lots of parental reassurance. And then if the child's really having a lot of nightmares, you want to try to figure out what else could be going on. Is there some underlying stress? Could they be being bullied at school? So you have to start to think about what else might be occurring that might be bothering them. Okay, another very common sleep problem is the child who delays going to sleep. So you put them to bed and they just won't stay in bed. You hear this prolonged stalling. It's kind of, you know, can I have a drink? I need to go potty, one more hug. And they won't go to sleep a lot of times unless the parent sits in there and to keep them into their bed. And this is a time when we really need to get strong with limit setting. Again, getting back to that sleep routine at night, that's important. Set up a quiet routine before bedtime, be consistent, have the bedtime the same every night. Again, those healthy sleep patterns really help. Allow your child to take a safe favorite thing with them to bed. Make sure he's comfortable. Make sure he's had that last drink of water. Make sure you've left the light on. You leave the door open. You want to try to handle any of those needs before bedtime so he doesn't use them to avoid going to sleep. And again, do not let your child sleep in the same bed with you. This will make it harder for him to sleep when he's alone. Do not return to the child's room every time he complains. Instead, you want to try waiting. So you kind of wait several seconds before answering, and then you make your response very quick. And this kind of gives him a little chance to fall asleep on his own. Constantly reassure them that he's there. You know, if you need to go in to reassure them, don't turn on the light, don't play with them, don't give them 3 more hugs, and don't stay too long. And then you kind of want to move further and further from the child's bed every time you go in, and then reassure him without entering the room. And then remind him every time he calls out that it's time to go to sleep. There's something called a bedtime pass, which we find successful in some kids, and that's for children who have a hard time staying in their bed. You might create what's called a bedtime pass. And you explain the strategy to them. You and I are going to make a bedtime pass for you to use at bedtime. You will get 1 pass per night, and after you go to bed, you can take the pass for 1 free trip out of your room for 1 reason. For example, if you need 1 more hug, you can bring it to me. 1 more trip to the potty, or for a drink, you can bring it to me. And then if you use your pass, you give it to your parents, and then you need to go right back to bed, and that's it. Your 1 time is over. If you do not use your pass and you still have it in the morning, then we can give you a special treat in exchange for that pass. And you need to be consistent. If your child calls out after using the pass, try to ignore him. This tends to work well for anxious kids because a lot of kids are anxious that they are not being allowed to get up. So sometimes just knowing that they have this card to allow them to get up may be helpful. There's another thing that often works for kids called bedtime fading. And it's an interesting thing where you basically try to delay their bedtime so they are so tired they will fall asleep easily. So for example, say a child normally goes to bed at 8 o'clock with you there, but you're trying to get out of the room and make it easier. So now you let them stay up until 10 o'clock. And now you can't let them fall asleep on the couch. They're actually truly staying up until 10. And remember, again, same thing with the bedtime. We don't want to be having screen time during that time. We don't want to be watching TV. We don't want to be doing anything exciting. Maybe you're just reading books for a couple hours for them to get really tired. Then you put them in bed at 10 o'clock so that they're tired, they fall asleep, and you're not in the room. So they're getting used to now falling asleep on their own. Then the next day, you have to make sure that they get up at the same time. We don't let them sleep in, we don't let them take a nap, so then the following night, you try to pull that bedtime back now by 15 minutes. So instead of a 10 o'clock bedtime, now you're trying for 9:45. And then over successive nights, you gradually pull that bedtime back to where you want it to. Then you go to 9:30 for a few nights, and then 9:15. So now the child is so tired that they can fall asleep easily and they don't need you in the room anymore. During, again, all of this, you have to keep the wake time constant, and you're gradually moving that bedtime back to eventually match their normal sleep cycle. With this also, positive reinforcement works well. You give incentives to stay in the bed, and you set a goal. If you stay in your bedtime and fall asleep, then tomorrow, you get a sticker, and so many stickers can mean a certain privilege. Just a couple of other things that I want to talk about because they're important to recognize. One is called obstructive sleep apnea. So if your child snores, and certainly if your child stops or hesitates during breathing, it's kind of a snore, 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 and then a kind of holding their breath. You want to discuss that with your pediatrician because this is a common cause of sleep problems, and it's something that has consequences. Obstructive sleep apnea is common in children. It can result in significant health problems if it's left untreated. It can cause cardiovascular problems. It can be related to growth and developmental delays. So it's important to recognize, and it can be treated. Most of the time in children, it's related to big adenoids, big tonsils, maybe sinus problems. So treatments are available, but that is the one medical thing that I want you to be aware of that you discuss with your pediatrician. Just a quick word about melatonin, again, because we get this as a question all the time. A little bit about melatonin. It's not a sleeping pill. It's a dietary supplement. Melatonin is a natural hormone-like substance produced by an area in the brain called the pineal gland. It's released naturally at night when it's time to go to sleep. So we all produce it. Now, when you're having sleep problems, melatonin is probably a good, safe thing to do short term for some kids when you're trying to get them into a routine. So for example, getting back to our child who's stalling for bedtime, it may be okay to use for a couple of weeks to kind of make them tired so that you can gradually get yourself out of the room and they establish a bedtime routine. Another good time for melatonin is when you need to kind of reset your clock. So the child during the summer who got all off schedule during summer break, they were up until 1 or 2 o'clock in the morning, and now we've got to get them back on a cycle for school. So that's probably another good time, but that's short-lived. That's probably the best use of melatonin. Melatonin may also help children that have a neurodevelopmental issue like autism or ADHD. But in general, kind of the rule of thumb is if you're going to use melatonin, you really want to discuss this a little bit further with your pediatrician to make those decisions together so that it's used properly and cautiously. Okay, and I just want to end with an Irish proverb that basically a good laugh and a long sleep are the 2 best cures for anything. Thank you.